Good evening, friends. Welcome to the session. FMGE June 2022. Most probable question I will try to cover maximum topics, maximum questions. First topic I start with pervasive developmental disorder or autism spectrum disorder. Yes. Let me see live chat. Pervasive developmental disorder or new name is autism spectrum disorder according to DSM-5 and ICD-11. It include these four. Autism. In autism a child is sitting and yes doing like this, means repetitive behavior, restricted and repetitive behavior, no eye-to-eye contact, social impairment of social interaction, impairment of communication and language. Means a child is sitting, not speaking to anyone, any language development is not there, yes, no eye-to-eye contact is there, yes, social development is not there, and stereotypic movement, autism. All three symptoms, autism. What is Asperger? If language is normal. Language is normal. You can see this question. A girl with normal milestone spends her time seeing her own hand. Child is, yes, very good evening dear Manoj. Yes, child is seeing his own hand or her own hand. Yes, means stereotypic behavior. Don't interact with other. No social interaction. No social interaction. 2 points. Language, they have not commented on language. So language, we will consider language as normal. Language is normal, so answer would be Asperger syndrome. Manoj, answer would be Asperger syndrome. But in the same question, I usually say they can ask the same question and they can ask, yes, they give no language development. No language development, same question, answer would become autism. Okay, same question, answer will change. In same question, if they gave the patient has deceleration of head growth after 6 months, means microcephaly, Rett syndrome, microcephaly. Good evening, Dr. Anil. Microcephaly, Rett syndrome. So if microcephaly is there, without second thought, answer is Rett syndrome. Recently 2 questions asked on Rett syndrome that all childhood psychiatric disorder are more common in males except Rett syndrome. Yes, only few. One of them is Rett syndrome. Rett syndrome is more common in females. This question was asked. And this Rett syndrome is X-linked dominant. X-linked dominant. Okay. Second question, Haller syndrome. In Haller syndrome, you will find normal development till 2 years after. Yes, Shivani, good evening. 2 years, then regression. So in the same question, if they give 2 years normal development, then after that these symptoms appear, Haller syndrome. Yes, if normal development up to 6 months and then regression 5 months, then regression, that is microcephaly, Rett syndrome. You can see Rett syndrome, Rett का जो head होता है, the head is very small. Okay. So recently asked question, all childhood psychiatric disorder means autism, ADHD, mental retardation, now the name is intellectual disability. Yes, more common in males. Specific learning disorder, more common in males. Tourette syndrome, more common in males. Okay. Now, advanced directive. What is advanced directive? Mental Health Care Act 2017. According to this Mental Health Care Act, we can direct in advance. What I said, direct in advance, means I can make a will that in future, if I am suffering from psychiatric illness, I should be treated in this way. Means I can direct the doctor, psychiatrist in advance that in future if I develop psychiatric illness, I should not be admitted or I should not be given electroconvulsive therapy. So I can make my will. It is also called living will. Living will. Okay. So an individual, a non-psychiatric disorder on treatment and a not minor can choose to decide the caretaker and the course of treatment according to Mental Health Care Act. This is called advance directive. No treatment directive, no terminology like this, no mental will, not future directive. Good evening all. Yes, this question has been asked in FMG recently, stage of death and dying. If I come to know that yes, I am going to die. Suppose I am having carcinoma. You must have seen Munna Bhai MBBS, Jimmy Sergil. When he was diagnosed having carcinoma, he started saying, no, I can't have carcinoma. I can't have this because I have not done that. I have not done this. How can I have carcinoma? So this is denial. This is denial. Very good. Dabda. Manoj, very good. Denial. Denial, then anger. What is anger? Hey God, why me? Hey God, why me? Then bargaining. Hey God, save this time. Once I am recovered from this means illness, I will not smoke, I will not take alcohol. That is bargaining. Then patient came to know that it can't be, now you can't be saved. He would go in depression. After some time he will accept. This is dabda. Dabda. Okay. Question was asked that which is not a part of stage of death and dying, and they gave agitation. Agitation is not part. That is anger. How to break bad news? Means if you want to tell a person that you are having carcinoma or you are going to die, you will take a spike patterns. Spikes pattern. This question has been asked. No one is going to ask. Means after that they don't ask about the different steps. Just remember spike, setting, perception, eye, invitation, knowledge, empathy, summary. Okay, spikes patterns. So now ECT, electroconvulsive therapy, picture MCQ. Whenever you will find convulsion, you will find the patient is unconscious. Unconscious. Mouth gag. Mouth gag. Okay. Mouth gag means to prevent tongue bite. This is ECT machine. Question can be asked. Frequently asked question on ECT. You will remember that similar looking picture, that is repetitive transcranial magnetic stimulation, RTMS. In this patient is conscious. Patient is conscious. So wherever you will find ECT, patient would be unconscious. Why unconscious? Because direct ECT is totally banned. Means you can't give direct ECT. If you want to give ECT, you will give patient general anesthesia and muscle relaxant. That is called indirect ECT. So indirect ECT, this is indirect ECT. This is RTMS. In RTMS, you will find the patient is conscious and there is figure of 8 shape. Okay, and this is magnet like. Nobody is going to ask detail what is the mechanism, but they ask when you consider RTMS, that resistant depression. You can use RTMS in resistant depression as a single modality only. Question. Vagal nerve stimulation again used in resistant depression. Resistant depression. Hi Pankaj. Hi Mia. Okay, I am interrupting the discussion. First of all, yes, now you are in sufficient number. Let me tell you that now few days are left. Remain positive during this period. never ever get disappointed. Whatever work you have done till now, that will pay you. The only thing you require is confidence. No anxiety should be there. Yes, as I promised that I will remain connected till the last. Yes, whenever you feel that you are demotivated, I am always there for you. Never ever feel alone. Okay, as a DBMCI family, we are together, and as a personal point of view, if you ask me, yes, I am always there for you. Never ever feel disappointed till fourth. I will remain communicated, will give you few recently asked topics, recently asked questions, so that at least we should continue the preparation, and we should remain in that situation that no anxiety should be there before the exam. If no anxiety, definitely you will clear your exam, I assure you. Yes, Pankaj, tension hoti hai. This tension is quite common. No need to take tension. Yes, if you have worked hard, or even if you are continuing and utilizing your time now, you will clear your exam, I assure you. This is my personal experience. Okay, so don't worry, I will take few sessions just to relieve tension and how you can perform better other than the academic thing. So remain connected. For the time being, we do more questions. Bade Miyan, Chote Miyan was not there. Definitely I will take more session of Bade Miyan, Chote Miyan soon. You will find. Okay, but this is more and more towards the orientation of subject, particular subject. Okay. So vagus nerve stimulation, resistant depression. Question is asked. Okay, Manoj. Yes. Which vagus nerve? Left vagus nerve is stimulated. Left vagus nerve is stimulated. Okay. Question. This is frequently asked question and student make wrong answer. Please do answer. ECT is safe and effective in which trimester of pregnancy? Yes, it is effective and safe in which trimester of pregnancy? Yes, that is all of the above. ECT is safe and effective in all trimester of. Yes, I will keep a session of in which I will take care of these aspects of preparation. So don't worry. After this session, yes, in 1 or 2 days, I will try to take a session in which how we can be more and more psychologically stable. This question, please do reply. What is the answer? A patient severe depression was treated with ECT. Severe depression, wherever you find suicide, you can think of ECT. You can think of ECT. Anesthesia gives succinyl choline, thiopental to the patient. What did these agents to do the patient? Yes, that is general anesthesia and muscle relaxant. Succinyl choline is muscle relaxant. Thiopental is general anesthesia. Okay. Now, according to Mental Health Care Act 2017, this question is asked that you can't give direct ECT. What is direct ECT? You must have seen in movies that to electricity wire, you put electricity wire straightening of hair. That is direct ECT. Now you can't give direct ECT to any person. Okay? You can't do sterilization. You can't do chaining. तेरे नाम मूवी, यस सलमान खान, अब तुम तेरे नाम मूवी नहीं बना सकते. You can't make तेरे नाम मूवी now because yes, chaining is prohibited according to Mental Health Care Act 2017. Decriminalization of suicide attempt. This is question. याद रखना IPC 309. Previously we used to say if you try to commit suicide, if you die it's okay. If you survived you will go for jail for 1 year. लेकिन Mental Health Care Act has removed, decriminalized this suicide attempt. So now you can. No, you should not. No need to commit suicide. Okay. Opioid every time favorite question of MCI. Opioid, most common opioid used is heroin. Heroin you know white in color, जितनी भी heroines होती हैं white ही होती हैं, ठीक है, सुंदर होती हैं, गोरी होती हैं, तो heroin is also white in color. So if you want to adulterate heroin, you can add chalk powder, you can add talcum powder, you can add charcoal powder. नो, दिस क्वेश्चन वाज आस्क कि हीरोइन को एडल्ट्रेशन करने के लिए कौन सा कंपाउंड यूज नहीं कर सकते, विच कंपाउंड कांट बी यूज्ड टू एडल्ट्रेट हीरोइन, दैट इज चारकोल पाउडर. एंड इफ यू overdose, recently asked question in NEET, so this may be repeated. Opioid intoxication. If you ingest if you take large amount of opioid, yes, there may be coma, pinpoint pupil, and respiratory depression. Triad. This is triad. Question is asked. Okay, very good. Triad question is asked. In this, remember, this is catching point. Question has been asked many times. Initial management, secure airway, means while you are preparing, you are giving IV naloxone. What I said, IV. One option was IV naloxone, one option was oral naloxone. So IV naloxone. Okay. So if you are giving IV naloxone, meanwhile you will secure airway. Okay. So initial secure airway, treatment of choice IV naloxone. Non-naltrexone is opioid antagonist. Naloxone is opioid antagonist, but naltrexone is not given. This is long acting, this is short acting. So naloxone is given. Okay. Withdrawal symptoms. Yes, withdrawal symptoms, frequently asked question. Sari secretion, all secretion are increased. Nasal secretion increase, GI secretion increase, diarrhea, sweating, lacrimation, rhinorrhea, all secretions are increased. And there would be yawning, specific symptom, yawning. Piloerection means straightening of hair, goosebump. Okay. Mydriasis. Yes, in this toxicity, pinpoint pupil was there. In withdrawal, mydriasis would be there. Body ache, insomnia. Yes, you know, in flu illness, there is body ache, lacrimation, rhinorrhea. Okay, so that is why it's called flu-like symptoms. Okay, withdrawal symptom, frequently asked question. Now, yes, cocaine, very good. Cocaine, Coca-Cola. If you drink Coca-Cola, your tongue may become jet black. Favorite question of MCI, jet black tongue. कोका नहीं तेरा कोका ये सॉन्ग है. कोका कहाँ पहनते हैं? नोज पिन आजकल तो नेजल सेप्टर में पहनते हैं, तो नेजल सेप्टल परफोरेशन. कोकेन, नेजल सेप्टल परफोरेशन. कोकेन कॉकरोच की तरह प्रोनाउंस होता है. यस, ऑर्गेनोफॉस्फेट में भी, ऑर्गेनोफॉस्फेट का सिम्टम बिल्कुल अलग होगा. इसका टिपिकल कोमा, पिन पॉइंट प्यूपिल, रेस्पिरेटरी डिप्रेशन. ओके, यस, कोकेन, कॉकरोच. यस, कोकेन, कॉकरोच, cocaine bug, tactile hallucination. Sometimes questions are asked that patient is feeling that cockroach or bugs are crawling under the skin. If feeling tactile hallucination, remember the same question is asked that if C word, if you find the word is given C, patient C, insects crawling over the skin, then it will become visual hallucination. So questions are asked in which we are preoccupied with tactile hallucination. So remember, if the word see, just like then visual hallucination, if feeling tactile hallucination. Now 27-year-old male man come to OPD with chief complaint of bugs crawling all over him. In examination there is black pigmentation of his buccal mucosa. Pulse rate, this is pulse rate. Okay, in cocaine there is sympathomimetic activity. Cocaine, yes, norepinephrine increase at synapse. So norepinephrine increases, so there is tachycardia. This question has been asked that in cocaine poisoning or cocaine intoxication there would be no bradycardia, there would be tachycardia. Clear? Now this question, please do answer. Please do answer. So this is cocaine. Yes, 7 question का आंसर cocaine है. Thank you, Natasha. Yes, please tell me the answer of this question. Most of time you find the same question again and again. Very good. Same question again and again, and in this only one word will give you the answer: clouding of consciousness. Wherever you find clouding of consciousness, altered sensorium, acute disorientation, yes, then without second thought the answer is delirium tremens. Answer is delirium tremens. Pankaj, remember this, I am specifically telling you this. If I change day 5, then answer would change or not? Yes, if I change, give the 5 day or 6th day, then thank you dear, 6th day or 5th day. Yes, no, it is not compulsory that delirium tremens would occur only 2nd or 3rd day. It may occur at any time, commonly occurs 2nd and 3rd day, but the diagnostic point is clouding of consciousness. Clear? It is delirium. It is delirium. And in this shaking means tremors. That's why tremors. So remember this point. If tremors are there, autonomic instability is there, then it is delirium tremens. If clouding of consciousness, then it is delirium. Why we are considering these two different things? If only and only delirium is there, sometimes you will not find the history of alcohol, you will not find this, then you will make the diagnosis of delirium, and in this the treatment would be antipsychotic, low dose. But if the same question, then answer would be IV lorazepam, IV लोरेज़ेपाम. और निमोनिक बना लो, कंसेप्ट बना लो, अल्कोहल हम सभी लेते हैं, नहीं लेनी चाहिए, मैं तो छोड़ दिए मैंने, आई हैव लेफ्ट. ओके, बट वेन एवर यू टेक अल्कोहल, ऑलवेज टेक thiamine. So in any disorder related to alcohol, the treatment include thiamine. Wernicke's encephalopathy, yes, thiamine, IV thiamine treatment. Korsakoff psychosis, oral thiamine. What is Wernicke's encephalopathy? Goa. Global confusion, ophthalmoplegia, ataxia. Okay, clear? So whenever you find Whenever you find that alcohol related disorder is there, always and always add thiamine in the treatment. Clear? Very good. Thiamine V1. Now, as you told, 48 to 72 hours, alcohol withdrawal, delirium tremens. Try. Di means 2 days, try means 3 days. You can remember. Yes. 24 to 48 hours, sometimes we say second day. SE for second, SE for seizure. सीजर क्या होता है? जनरलाइज टोनिक क्लोनिक सीजर. अल्कोहल नहीं लिया, यू आर नॉट टेकिंग अल्कोहल फॉर few days, 1 day, 2 day, and you started having generalized tonic clonic seizure. Okay, and these seizure comes in clusters. Cluster means in a short time you will find multiple episode of seizure. And never ever give anti-epileptic. In this we give IV diazepam. Yes, we can also give other benzodiazepine, but according to Kaplan, they have given IV diazepam. Okay. 6 to 8 hours. After 6 to 8 hours, most common symptom tremors. You must have seen many person who take alcohol for a long time. Okay, wake up in the morning, 6-8 hours of sleep. After that, they start having shaking hand, tremors. So most common tremors after how many days? How many hours? Sorry, 6 to 8 hours. Okay, you can remember easily. Clear? Recently asked question that if a person is taking alcohol for a long time and now comes to emergency, yes, and you don't have lab facility. What I said? You don't have lab facility. Which drug you will give? Lorazepam. You will give lorazepam. So if liver function is compromised, or you can't determine the status of liver, you will give lorazepam. Remember this point. Okay. Nistha, no valproate. Valproate is not actually in G's. Why we don't give in these seizure, alcohol withdrawal seizure, we don't give anti-epileptic. If you start anti-epileptic, nobody is going to stop these anti-epileptics. This patient will, okay, 10 hours के बाद 10 hours, 12 after 12 to 24. Okay, remember these are the probable, means most commonly, but it doesn't mean that these are the absolute. Means you will find that alcoholic seizure on the first day. You may find delirium tremens on the second day. You may find delirium tremens on the first day also. So it is question purpose. Okay. Okay, Mia. So this is for question purpose. Otherwise 12 to 24 hours alcoholic hallucinosis. I usually remember like this कि सुबह उठते ही हाथ कांपने लगे, फिर आवाजें आने लगेंगी, लेया लेया अल्कोहल लेया, लेया लेया अल्कोहल लेया. यदि उसके बाद भी नहीं लाएगा, अगले दिन सीजर आ जाएंगे, और उसके बाद भी नहीं होगा तो तीसरे दिन वो डिलीरियम में चला जाएगा. ओके. These two questions were asked in FMGE back to back in the same paper. Capgras syndrome and Frigoli syndrome. What is Capgras? Suppose there is a lady in the ward. She says that my husband is not my husband. He is looking just like my husband. He is behaving just like my husband. He is talking just like my husband. Everything is just like my husband, but he is not my husband. When you ask, why are you saying like this, he is not your husband? She said that yes, he is wearing cap. I made mnemonic, Capgras. मतलब मेरा हस्बैंड नहीं है, कोई और आदमी है जो बिल्कुल मेरे हस्बैंड जैसा दिखता है, बातें भी वैसी करता है, यस, स्माइल भी वैसी करता है, चलता भी वैसी है, एवरीथिंग जस्ट लाइक माय हस्बैंड, बट ही इज नॉट माय हस्बैंड. यस, Capgras syndrome. Patient believes that a familiar person has been replaced by similar looking stranger. ठीक है, यानी कोई और आदमी मेरे हस्बैंड की तरह दिख रहा है लेकिन ये मेरा हस्बैंड नहीं है। फ्री गोली, व्हाट इज फ्री गोली? यस, ओके, हिंदी में आई विल एक्सप्लेन फ्यू पॉइंट्स इन हिंदी ऑल्सो। यस, सो सेकेंड फ्री गोली, पेशेंट सेज, पेशेंट कहता है कि द पर्सन हु इज सिटिंग आउटसाइड माई फ्लैट इज नॉट बैगर। एक बैगर बैठा है फ्लैट के बाहर, पेशेंट सेज दैट ही इज नॉट बैगर, ही इज somebody else, sorry, he is my boss, sorry, he is my boss, he has changed his physical appearance just like beggar, he has changed his physical appearance just like beggar। वो beggar नहीं है, he is my boss, he want to keep eye on me, मेरे पे नजर रखना चाहता है। and says that yesterday I met a person in post office, he was not postman, he was my boss, he changed physical appearance just like a postman। Yesterday I also met a policeman and I recognized that policeman is not policeman, he is my boss, he changed appearance just like policeman। means my boss can change मल्टीपल फिजिकल अपीयरेंस, मेरा बॉस मल्टीपल फिजिकल अपीयरेंस ले सकता है, जैसे कि मास्क चेंज कर दे। थैंक यू डॉक्टर मंजुनाथ। यस, जैसे फेस मास्क चेंज करते हो, जस्ट लाइक यू आर चेंजिंग द फेस मास्क। Patient believe that a familiar person is changing his physical appearance, means familiar person, my boss, is changing his physical appearance just like beggar, just like postman, just like policeman, and he can take multiple different physical appearance। गोली दे रहा है, ठीक है, गोली दे रहा है, कहते हैं ना गोली दे रहा है, ठीक है। Psychosis and neurosis, what is the difference between psychosis and neurosis? Psychosis ये ओल्ड कंसेप्ट है लेकिन क्वेश्चन आते हैं। सपोज ए पेशेंट ऑफ सिजोफ्रेनिया केम टू मी, तुमने उससे पूछा, आई आस्क हिम व्हाट इज द प्रॉब्लम, ही सेड डॉक्टर साहब आई हैव नो प्रॉब्लम, माय फैमिली मेंबर वांट्स टू किल मी। नोबडी वांट्स टू किल हिम बट ही बिलीव्स दैट माय फैमिली मेंबर वांट्स टू किल मी, मीन्स ही इज नॉट अवेयर अबाउट हिज इलनेस। तुमने कहा तुझे बीमारी है, सिजोफ्रेनिया है, वो कहेगा ना ना डॉक्टर साहब आई एम नॉट हैविंग सिजोफ्रेनिया, मीन्स ही इज नॉट अवेयर अबाउट हिज इलनेस। मीन्स इनसाइट इज अवेयरनेस, अवेयरनेस अबाउट इलनेस। इन साइकोसिस एब्सेंट, न्यूरोसिस प्रेजेंट। डिप्रेशन में पेशेंट आएगा, ये फेवरेट क्वेश्चन है तुम्हारे एमसीआई का, डिप्रेशन पेशेंट आएगा, यस, डिप्रेसिव पेशेंट वुड कम से डॉक्टर साहब आई एम सैड, आई एम नॉट फीलिंग वेल, I have no interest in daily activity, I am not able to sleep, I am not able to eat properly, please treat me। means he is aware about his illness, means insight is present। Neurosis, depression is neurosis। Contact with reality, in psychotic schizophrenic patient nobody wants to kill him but he believes that my family member wants to kill me, means he is not aware about the reality, तो contact with reality absent परसेंट। लेकिन ये क्राइटेरिया अब नहीं मानना। वाई? समटाइम्स यू विल फाइंड द सिजोफ्रेनिक पेशेंट टेकिंग मेडिकेशन इज मेंटेनिंग वेल ऑन मेडिकेशन, वुड कम टू यू एंड वुड से डॉक्टर साहब आई एम हैविंग सिजोफ्रेनिया, प्लीज चेंज माई ड्रग, आई एम गेटिंग वेट विद ओलंजापिन। मतलब ही इज हैविंग इनसाइट। So insight is not a good criteria to differentiate psychosis and neurosis. Now we say better is delusion or hallucination. Delusion, if question is asked what is the difference between psychosis and neurosis, option A insight, option B delusion, better answer would be delusion, okay, or better answer would be hallucination। Got the point? Clear? Insight, yes, highest level of insight is emotional insight, mug it up, okay, I am not going to describe it। emotion हमेशा above होते हैं इंटेलिजेंस से। क्या कहा मैंने? इंटेलेक्चुअल इंसाइट और इमोशनल इंसाइट कौन सी हाईएस्ट लेवल है? इमोशंस आर मच मच स्ट्रोंगर, बेटर, okay, just like why I am here, not to teach you psychiatry, I am here just to tell you that we are there, yes, at least to share some thoughts to give you confidence, to help you. So never ever feel helpless. And if we are emotionally connected, emotions give us strength, and this strength will help us to clear our exam. Okay, so emotional things are always better, I usually say. That's why nowadays you must be aware about that. EQ is more important than IQ. So we are emotionally connected, and yes, on the behalf of those emotions, yes, as a part of Bade Miyan Chote Miyan, yes, you will clear this exam, I assure you. And I will come, yes, as demanded by few students, we really will come before the exam multiple times, so that you should not be disappointed at any point of time. Again, I am repeating, whatever you have worked, that is sufficient to clear your exam if you remain positive. So remain positive, have confidence, we are there. Frequently asked question of MCI: erectile dysfunction, most common cause psychogenic, organic cause diabetes, How you can differentiate? Patient came to you having erectile dysfunction, you ask a single question: do you have early morning erection? If early morning erections are present, yes, it is psychogenic erectile dysfunction. If early morning erection is absent, you will think of organicity. Nocturnal penile intumescence, in night when you are sleeping, at that time erections are also there. We can also monitor that, and we can differentiate. In psychogenic, nocturnal erection will be present. In organic, nocturnal erection would not be there. So psychogenic, these would be present. Organic, these would be absent. Clear? Treatment: dual sex therapy, Master and Johnson technique, couple is treated. Sexual disorder are considered the disorder of couple, not a single person. It is considered the disorder of couple. So couples are treated. But in India, you will find that commonly the single male person would come having erectile dysfunction. So, but actually dual sex therapy or Master and Johnson technique, that is sensate focus technique, means which are the zones which can be stimulated to get the erection. Pharmacological treatment, we have sildenafil, tadalafil, phosphodiesterase 5 inhibitors, you all know. But best is psychological. Premature ejaculation definition: previously we used to say orgasm before, yes, ejaculation before the orgasm of female, but now we say if orgasm occur before 1 minute after penetration, that is premature ejaculation. It may be usually psychogenic. It is. Treatment: squeeze technique. Question is asked, this is also couple therapy. Remember this. Stop start technique, Siemens technique. Question, frequently asked question of MCI. And drug treatment: SSRI, latest approved drug dapagliflozin. Nowadays you will find so much of, yes, advertisement of dapagliflozin. Okay, short acting SSRI side effect is it delays ejaculation. And yes, dapagliflozin you can use on SOS basis, means before the sexual act, short acting SSRI. Frequently asked question on depression, mnemonic for this is EMI, gaps cause depression. EMI, energy, mood, interest. Okay, guilt, appetite, decrease psychomotor activity, decrease sleep, suicide, decrease concentration. If out of these 5 symptoms are there, yes, I am taking 5 DSM-5 care according to DSM-5. If 5 symptoms are there, you will say diagnosis is depression for 2 weeks. How much duration? 2 weeks. Now, suppose these symptoms appear after financial loss, breakup, medical illness, divorce, then Diagnosis may be adjustment disorder. Remember this point. Whenever we see divorce, when we see the word divorce, breakup, medical illness, financial problem, we immediately mark the answer adjustment disorder. No. Remember, if you find this question, 29-year-old lady was divorced by her husband. After that, she remains sad, unable to sleep, don't take food. Three symptoms are there. This is not depression. This is adjustment disorder. The answer is adjustment disorder. But in the same question, if I say, yes, decrease interest, decrease concentration. Okay. Decrease interest, decrease concentration means 5 symptoms. Okay, 5 symptoms are there. Diagnosis of depression for 2 weeks. Diagnosis of depression is fulfilled. Diagnosis would be depression. So remember this point, that whenever you find a question after breakup, after financial loss, means you are thinking of adjustment disorder, and if the diagnostic criteria of depression is fulfilled, you will mark the diagnosis depression, not adjustment disorder. What is squeeze technique? Yes, Hemant, squeeze technique, male genitalia, penis is stimulated by the female. When male is about to ejaculate, then female press the tip of the penis till the urge of ejaculation goes. This is repeated multiple times. After some time, patient learn how to hold ejaculation. That is squeeze technique. Stop-start technique, when the person is performing sexual intercourse, when he is about to ejaculate, he stops. When the urge of ejaculation goes, then start again. That is stop-start technique, Siemens technique. Okay. Yes, frequently asked question. Young girl came to OPD on examination, observed multiple linear superficial scar mark on forearm, multiple superficial scar mark. Took history from informant, found that she is having impulsive behavior. Frequently asked question, impulsive behavior, black and white view. Black and white view, borderline personality. Yes, multiple linear scar mark without second thought. Yes, suicidal tendency is there. Yes, it may be suicidal tendency. Yes, it may be deliberate self-harm, but they have given that young girl, suppose 18, 19, 20, means they will give the age and they will give 2-3 years. These symptoms are there. Impulsive behavior is there. Yes. So that will lead to diagnosis borderline personality. Okay. Mania, there is pressure of speech. Question is asked, pressure of speech. A manic patient is very happy. He is speaking continuously and you want to stop this patient, but you are unable to stop. Yes, that is called pressure of speech. Means his speech is having so much of pressure. Yes. Yes, that is mania, pressure of speech seen in mania. So I will try to cover as many as questions possible. Abnormality in appropriateness of affect. Affect is emotional state which is expressed outward. Suppose you go to the marriage party of Deepika, you must be happy. Yes, if you go to the marriage party of Deepika, you must be happy. But if you go to marriage party of Deepika and start crying, then I will say you are schizophrenic. You may have schizophrenia and the affect is inappropriate. If you go birthday party of Taimur and start crying, then I would say inappropriate affect. If you go to funeral and start laughing, then I would say inappropriate affect. No, prolixity I am going to describe, don't worry. Prolixity I am describing. This is flight of idea. Yes, flight of idea is, even if you don't remember this, a patient of mania says that I love my home, home is sweet, home sugar is sweet, sweet gives diabetes, diabetes have sweet urine. Means speed is fast. Speed is fast and one word association. This question was asked. One word association, that is sweet, 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 one word association, and speech is fast, that it is flight of idea. But if less severe form of flight of idea, it is also called ordered flight of idea, that is prolixity, seen in hypomania. Seen in hypomania. Clear? Circumstantiality, this question has been asked. A schizophrenic patient is asked, what is your blood sugar level? Patient says, Dr. Saab, you know diabetes is very disabling condition. In this blood sugar is high, sugar comes in urine, sugar accumulate in body, affects all part of body, my blood sugar is 180. Means he gave you blood sugar level, but before giving the answer of this question, yes, a normal person क्या होगा? If you ask what is your blood sugar level, a normal person would say my blood sugar is 180 milligram per deciliter. But a schizophrenic patient gives so much of history. Diabetes is this, diabetes वो है, ये है, वो है, और आखिर में तुम्हें बता दिया my blood sugar is this. Means goal is achieved. That is circumstantiality. Extra detail, goal is achieved, circumstantiality. Delusion of love. Patient believes that someone is in love with him or her. Suppose a rickshaw puller says Priyanka Chopra or Gandhi is in love with him. When you ask, how can you say that she is in love with you? He says that, Dr. Saab, I know. Whenever she comes on the TV, yes, she wears always red color of, dresses. I like red color. That's why. I know she loves me. Okay, he has never met her in life, but he says that she is in love with me. That is delusion of love. It's also called erotomania. Erotic word is used for love, but Raj Kundra could not understand the thin line between erotic and porn and was booked. Okay, D. Clarenbolt syndrome, clean bolt, Clarenbolt. Yes, लड़की को देखते ही clean bolt हो गया ये रिक्शा वाला, तो clean bolt, Clarenbolt. So this is question. Okay. Illusion. Illusion is disorder of perception. Simple question is asked. Misinterpretation of stimuli. Means question has been asked. Misinterpretation of stimuli. Suppose you are going through a dark street, you saw a rope and you considered this rope as snake. That is illusion. Rope lying in the road considered as snake. This is illusion. Okay, is speed okay? Yes. Next question. A 40-year-old male always doubt his neighbor and fight with him without any reason of 1 year, reports occasional hallucination. Rest behavior is normal. This can be due to, yes, please do reply. Yes, in this the answer is persistent delusional disorder. Remember this point. In this question, patient has, yes, doubt on neighbor and fight with him, means he is having delusion of persecution. Delusion of persecution. Other than delusion of persecution, this patient is having occasional hallucination. If in the same question, if I remove the word occasional, then answer would become schizophrenia. Schizophrenia, delusion plus hallucination. Okay, let me tell you, look at this. I will give you handouts on my yes, Telegram channel, don't worry. If suspiciousness is there, delusion is present, hallucination is present, then paranoid schizophrenia, correct? Okay, Jitendra, in the same question, delusion is present, no hallucination or occasional hallucination. Means occasional hallucination may be present in persistent delusional disorder. So in this question they have given that occasional hallucination is there. That's why the answer is persistent delusional disorder. In the same question, if occasional word is removed, the answer would become yes, paranoid schizophrenia. Clear, Jitendra? And sometimes you will find that patient is having no delusion, no hallucination present since adolescence. Means in the same question sometimes you will find that suppose 20-year-old male doubt his neighbor without any reason, and for 2 years, okay, so then you can think answer paranoid personality disorder, because paranoid personality disorder start in early age. Clear? Personality disorder start in adolescence. Question is asked. Personality disorder diagnosis should be made adolescence. So no delusion, no hallucination present since adolescence, paranoid personality disorder. 3 questions you can solve. Antipsychotic, first generation antipsychotic, second generation antipsychotic. First generation is called typical antipsychotic, D2 receptor antagonist. Atypical antipsychotic, dopamine receptor or serotonin receptor antagonist. So remember, first generation, 1 type of receptor is inhibited. Second generation, 2 types of receptors are inhibited. First generation, only positive symptoms are resolved. Second generation, both positive and negative symptoms are resolved. Clear? This test, whenever you see this symmetric word, symmetric picture, this is called Rorschach test. Without second thought, symmetric picture, card, guess, Rorschach test. This question, latest development, that all of the following indicate good prognosis of schizophrenia except late onset, yes, good prognosis. Early onset, poor prognosis. Associated with depression, good prognosis. Developing country, poor prognosis. Previously we used to say developing country have good prognosis, but now we say developing country have poor prognosis. Positive symptoms, good prognosis. Negative symptoms, poor prognosis. Okay? Yes. Last question for the day. Yes, 55-year-old man with chronic schizophrenia was found to be maintaining abnormal posture for a long time. Which of the following symptom? Answer is posturing. Answer is posturing. If patient maintain this posture, spontaneously posturing. But if you do passive movement and resistance is there, the answer is waxy flexibility. If passive movement resistance is there, just like you are bending wax candle, yes, just like you are bending wax candle, yes, then it is waxy flexibility. Let me complete this question. This is question from FMGE itself. After repeated exposure to, what was the experiment? Yes, let me tell you this very, very important point for your exam point of view. Yes, if you will follow this concept, you will never be hopeless. Let me tell you what was the experiment. Yes, what was the experiment? There was a cage. In this cage there was a monkey. He was closed. Whenever in this experiment, whenever this door was opened, they attached electricity wire and they gave electric shock. Means they switched on the electric current and opened the door. When this monkey tried to come out of the cage, he got electric current, he got shock, and he came back. Every time it was done, this door was opened and electric current was put. So monkey started, every time this monkey tried to come out, but every time he got shock and set and remain at this point. Now, after some time, after so many episodes of this event, yes, they removed this electric current, they opened the door, but monkey never tried to come out because he learned that he is helpless. He learned that he is helpless. In the same way, many times we feel helplessness. We feel helplessness. 19 subject, I will not remember, I will forget. No dear, don't think like that. There are possibility that doors are open and no electricity is there, power cut is there, and you may jump. So never ever feel depressed. Attempt till last. Do hard work till last. You never know, this time the door will remain open and there would be no electric current. There are chances. Many times we don't attempt because we think that every time 19 subject I forget, how can it be possible this time? No dear, this is possibility that this time exam questions would be like that in those subjects which are weak. Simple questions are asked. Many times I have seen that many students clear exam. They suppose I prepared out of 19 subject, I prepared 12 subject very well. But I am disappointed. I could not prepare 7 subject properly. Or I could not prepare 12 subject properly. But what happened? Those 7 subjects, those 8 subjects which I have prepared very well, they gave more questions from that. In MCI it is quite common. And those top subjects which I have weakness, in which I have weakness, they gave simple question or they gave less question. So the chances are always there. Whenever you appear in exam, think like that, this may be the chance when I can clear. So even if you have not prepared well, you wasted your time, even then think like that, okay, I will appear in the exam with full confidence. There are chances that I can clear this exam. Okay, so तुमने देखा होगा कि कुछ हिंदी सॉन्ग्स भी हैं. शाहरुख खान की एक मूवी थी, जिस चीज़ को तुम दिल से चाहो सारी कायनात तुम्हें उसे मिलाने में लग जाती है, ऐसा कुछ था, है ना. तो ये रीज़न क्या है? ये क्या सच है? हाँ, ये सच है. ये तुम बार बार किसी चीज़ को चाहते हो और उसके लिए एफर्ट करते हो तो प्रोबेबिलिटी तो है. पीएसएम में पढ़ते हैं हम कि प्रोबेबिलिटी है, देयर आर प्रोबेबिलिटी. यस, पिकअप, रैंडम पिकअप, सैम्पलिंग करते हैं हम, रैंडमली सैंपल करते हैं, किसी को भी उठा लेते हैं. तो हो सकता है तुम भी सैम्पलिंग में आ जाओ, लेकिन खड़ा तो होना पड़ेगा ना. यू मस्ट बी ए पार्ट ऑफ दैट डोमेन इन विच फ्रॉम विच सैंपल्स आर बीइंग टेकन. तो तुम पहले से ही छोड़ दोगे, नहीं यार अब नहीं हो सकता. जितने भी दिन हैं, ट्राई टू यूटिलाइज एज मच एज पॉसिबल, ट्राई टू रीड एज मच एज पॉसिबल. चांसेस हैं, अब भी हैं चांसेस कि तुम जो पढ़ो वही आ जाए. मैं कहता हूं कि भगवान से क्या मांगना है? हे गॉड, हे गॉड डायरेक्ट मी टू रीड दोज टॉपिक्स विच आर गोइंग टू बी आस्क्ड. हम मांगते क्या हैं? हे भगवान, मुझे जो मेरे याद है वो एग्जाम में आ जाए. भगवान नहीं कर सकता. भगवान, गॉड इज फॉर एवरीवन. एक क्वेश्चन तेरा, एक क्वेश्चन तेरा. बट नाउ व्हाट यू विल आस्क गॉड? Hey God, direct me to read those topics which are going to be asked. जब भी disappoint हो, open any page of any notes and read that. और भगवान से प्रार्थना करना, भगवान वही पढ़ाना जो एग्जाम में आना है। भगवान कर सकता है, बड़ा सिंपल सा काम है, ही विल डायरेक्ट यू। एक बार मेरे साथ हुआ था, आई वॉज रीडिंग, मैंने भगवान से कहा भगवान वही पढ़ाना जो एग्जाम में आना है। बड़ी तेज हवा चली, पन्ने पलट के 4, और मैंने वो पढ़ लिया, वो आ गया। मतलब जिसे जस्ट लाइक ए जोक, बट ट्रस्ट मी, दिस इज बिलीव सिस्टम इन साइकेट्री। जब हम विश्वास करना शुरू कर देते हैं किसी चीज़ में तो वो होने लगता है। तो इफ़ यू बिलीव दैट यू आर स्ट्रोंगर, यू कैन डू, यू कैन। और ये तुम बिलीव करोगे वी कांट, वी कांट। सो हमें बिलीव रखना है कि हम कर सकते हैं, वी कैन डू, और हम करेंगे लास्ट मोमेंट तक। हमें जस्ट लाइक क्रिकेट मैच, तुमने यू मस्ट हैव सीन मैनी क्रिकेट मैचेस इन विच वी आर लूजिंग, उसके बाद भी हम होप रखते हैं कि ओके 20 बॉल्स 80 रन्स, हर बॉल में चौका लग जाए तो हो सकता है। ऐसी सोच होती है ना हमारी। बट वी एक्सपेक्ट फ्रॉम अदर पर्सन, तो वाई कांट वी एक्सपेक्ट फ्रॉम अस कि हर एवरी बॉल, अभी तुम्हारे पास जितने दिन हैं, हर दिन 8 घंटे 10 घंटे पढ़ूं और सेम क्वेश्चन आ जाए, एग्जाम क्लियर। सो बी पॉजिटिव, रिमेन कनेक्टेड, बेस्ट ऑफ लक, थैंक यू।